Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms Podcast. We are continuing our family healthcare series today with Hackensack Meridian Children's Health, welcoming Dr. Brittany Parlow. Dr. Parlow is a board-certified in general pediatrics and pediatric gastroenterology, as well as a certified nutrition support clinician. She offers comprehensive care and management for children with a variety of gastrointestinal and nutritional disorders. Her clinical interests include nutrition and growth disorders, celiac disease, constipation, gastroesophageal. I'm butchering this, but I'm doing pretty good.
You are doing good.
Reflux disease, feeding disorders, inflammatory bowel disease, and allergic disorders. She is passionate about developing strong, long-lasting relationships with her patients and their families, and working with them to develop the best possible care plan. Welcome.
Thank you. Thank you for having me. No, sorry. Thank you for having me. It's great to be here.
So I was just chatting a little bit and mentioning how this is the topic that we actually haven't covered. So we've been doing I think we've been doing this healthcare series for like close to 2 years now. It's been a while. And we haven't talked about, going into the winter, it's like the dreaded, like, what does your kid have? What's going around right now? I know, like, the last month and a half, like, everyone's had walking pneumonia.
This year. It's been mycoplasma pneumonia has been really, really, really much more common than we've seen it before.
Yeah, you don't hear that too often.
You don't.
Actually, my daughter's friend's mom said like last week that she had bronchitis and that she still wasn't getting well, and I was like, you should go get checked for pneumonia because I think everyone has that. And she lo and behold, she did. So so that's scary.
I know.
Yeah. I'm just gonna say the worst thing that you can get, that your family gets knocked down with, is the stomach virus.
Absolutely. Yeah.
Like, it just is.
Agree. Yep. No, I agree. It's hard to function.
Like flu sucks and stuff where and flu too, you guys can throw up a little bit, but like, you get like, it sucks and you feel like crap for a week or whatever. And you're like, sometimes can't get out of bed, but that, like, even 24 hours, it's just miserable.
No, absolutely. And I think one of the most frustrating things for parents and for families is that there's not good treatments for GI bugs. And so you're kind of stuck with it. And, it's frustrating. The symptoms are not fun. And so you are absolutely right. This is unfortunately a common time of year. I think it's a combination of we're all inside more and we're all back to school. And, the fall and winter tends to be a time where we see a lot of GI bugs. The biggest culprits this time of year are viral gastro bugs. So norovirus is one. That's sort of like the classic one you hear about that, like, goes through a whole cruise ship. It's incredibly contagious. It's hard to avoid if there's people around you that have it.
Is it airborne? Like, can you prevent it by washing your hands and stuff?
It is preventable by hand washing. Okay. It just can be hard, especially with young kids who are playing together and you don't know exactly. But but washing your hands can prevent it. But unfortunately it is very, very contagious. You only need a very small amount of the virus to get into your system to get sick from it. And so that's part of what makes it so contagious. Norovirus is one. Astrovirus is another common virus we see this time of year, sapovirus. And we've been seeing tons of them, in the hospital and in the office.
Interesting. And what's the difference?
They all honestly have very similar symptoms. It's kind of hard to tell them apart based on just how kids are clinically doing. A lot of times we figure out which one they have if their symptoms are lasting longer. We end up doing stool studies on them. We'll send a panel. It'll come back and tell us which one. But again, probably the most frustrating part for us as doctors and for families is that there aren't good treatments for these viral GI bugs. The treatment is what we call supportive care, which basically just means trying to make sure your kids stay hydrated and, things like Pedialyte or electrolyte drinks can be helpful. But a lot of it, you just have to wait out, which is frustrating. And so it's usually kind of this his characteristic, like, starts with belly pain, sometimes low grade fevers, and then you may vomit for a day or two, and then it kind of transitions into diarrhea, and the diarrhea can last for a while. I mean,
Yeah.
sometimes up to a week.
Mhm.
We usually tell parents if it's going on for more than a week, that may be a time to check in with your pediatrician and just sort of make sure there's something else going on. But um, you know, sometimes you just have to wait it out. It gets frustrating. And then I know, I have 3 kids. And so by the time, it gets through the third one, we're talking about like a 3-week thing sometimes that for the whole family is better, which this time of year is not the most fun
Oh, I know. They'll probably hate me for calling them out on this, but we went to my brother-in-law's for Christmas Day,
thing.
like it was 2 or 3 years ago.
Mhm.
And we all left, like someone, like their son started throwing up during dinner.
Oh no.
And then like, somehow I think my sister-in-law got it like later in the day. Like, I don't know how quickly she must have also had it.
Maybe,
Yeah.
exactly. She didn't have any
Something,
symptoms
because it
yet.
was in the
Yeah.
same house. I don't even know. But we all like went down like within the next like 3 days. It
Oh,
was
it's
like, thank you,
awful. I
Merry
know.
Christmas.
Best Christmas gift. I
Yeah.
know.
So terrible. Can newborns get like
They
they
can,
can?
they can,
Okay.
and unfortunately, they can get pretty sick from
Yeah.
them too. And so those are the kind of family members you may want to avoid if anybody in the family has anything. Avoiding
Yeah.
newborns is a good idea. Rotavirus is another really common GI bug that can be very severe for newborns, and so that's the one that newborns actually get vaccinated against. I don't know if you
I see.
they get it's a liquid vaccine, so it's
Hmm.
like the one that stands out to parents because it's not an injection; it's this little liquid, and the reason we vaccinate newborns for rotavirus is because again they could get a lot end up
Mm.
being hospitalized if they do get it, especially kids under 6 months. And
Okay.
so the rotavirus vaccine is recommended at 2 months, 4 months, and 6 months for infants, partly just because again, and interestingly, the immunity to the rotavirus vaccine doesn't last forever, like a lot of the vaccines you get when you're a baby.
Hmm.
But the point of it is to prevent the little babies from getting it.
I
An
see.
older kid getting rotavirus may still get sick and annoying symptoms, but hopefully and less likely to be hospitalized from it, but the infants can get really sick. And so
Oh,
that's, again, tough time of year to have an infant.
totally. I think most kids are notorious. I can test to my daughter on a weekly, if not multiple times during the week basis. What's wrong? Oh, I don't feel good. My stomach
Belly
hurts.
hurts. Yes.
My head hurts. I didn't sleep well. I'm like,
Yeah.
what? You slept for 10 hours. What are you talking about? She's
Yeah.
just like,
Yeah.
but also when they are complaining about that, like when to, really take it seriously. When, your child maybe keeps saying like my stomach hurts, but they're not like expressing any other symptoms.
Hmm.
What can that be symptom of? And like, what, do you see more, I guess more, what's more prevalent
Yeah.
when they end up in your care?
Yeah, no, it's a good question. And you are absolutely right. Belly pain is a really, really common complaint in kids, all different ages. And the common things do vary a little bit based on the age of kids. One of the more common things we see is what we call functional abdominal pain, and that's similar to what you're describing. It's the kinds of kids that sort of on a regular basis complain, my belly hurts, but they don't have a lot of other sort of what we call red flag symptoms. And so, things that make us much more concerned about something more serious going on are, fevers, vomiting, diarrhea that's not going away within a couple of days. Anytime we're seeing blood in the stool or blood in
Mm.
vomit is always a red flag to us. Belly pain that's severe enough where it's affecting our kids' ability to function, especially things they like to do. And so when I have parents that say, they love dance and now their belly hurts, they don't want to go to dance or they don't want to go to soccer, that's always a little bit of a red flag to us. Um, Other things like concerns about losing weight or not gaining weight well or not growing well.
Mm.
Those things are definitely things that we want to look into more and sort of make sure we're not missing something. Um, you know, but a common thing though is what we call functional abdominal pain, and that kind of pain is tough because it's a little bit less what we call specific, meaning that a lot of times kids just sort of this general, my belly hurts, but they have a hard time describing it, and they have a
Mhm.
hard time pointing to where it hurts, and they have a hard time sort of explaining what it feels like or what they think is causing it. And sometimes that kind of belly pain, it can be more stress related, and so
Mm.
we often have parents, try to see if there's any pattern. Is it always before school? Do they have a test coming up? Anything going on with their friends at school? Sometimes it's diet related too. And so it can be really helpful for parents who have kids who frequently complain of belly pain to start making a little, like a symptom diary, we call it. And so, you don't have to write down every single thing they eat forever, but try to pay attention to, hey, she complained. What was the last meal we ate? Was there dairy in that meal? Was there gluten in that meal? Is there anything? And then if you kind of keep tracking that, see if there's any commonality, in the times they complain, time of day. Is it, again, always after breakfast or after dinner? Other common things that cause belly pain in kids, constipation is a really common one we see. And that can be also kind of confusing because sometimes we see kids who end up, we find out they're constipated, but they poop pretty regularly. And so parents are understandably kind of confused of, I kind of understand they poop every day. How could they be constipated? But sometimes even in kids who have bowel movements on a regular basis, they don't fully empty their bowels, and so they might have very small bowel movements or little hard balls of poop, and then they can still sort of over time get backed up where there's a lot of stool or poop kind of sitting in there, and that can be painful. What happens is your colon starts to stretch a little, and that pressure on the wall of the colon is very uncomfortable, and so that's often one of the first things we're looking for and asking about. You know, there's lots of other reasons that you can get belly pain. And again, I always advise parents to talk to their pediatrician, especially if it's going on for more than a couple of days, especially if it's affecting their ability to get to school, to do activities they like. They don't want to hang out with their friends anymore. Then that's definitely a reason they should be seen. And then again, a lot of times they end up in our office, and we're happy to see them. And, depending on some of the characteristics, we're going to start potentially doing more workup for things like celiac disease or, things like inflammatory bowel disease, which is Crohn's disease or ulcerative colitis. And again, there's a huge differential for belly pain. But, we definitely, worry more about kids with some of those red flag symptoms.
Okay. Yeah. Interesting. Uh, lactose intolerance, is that sometimes like combined with something else like underlying that they have?
It can be. So that's a good question. So there's two kinds of lactose intolerance. There is what we call primary lactose intolerance. So that's so what lactose intolerance is when we don't have enough of the enzyme. The enzyme's called lactase that helps us break down lactose. And so when we are born, we have tons of this lactase enzyme that lines our intestine. And that's because infants are very dependent on lactose. Lactose is the sugar that's in breast milk. It's the sugar that's in infant formula. And they need lactose to survive. It's incredibly rare to have what's called congenital lactase deficiency, where an infant is born with a lactose intolerance. But as we get older, we honestly probably don't need as much dairy. I mean, don't get me wrong, I love cheese and I like dairy, but it isn't as necessary for us to eat dairy. And so as we get older, sometimes the lactase, that enzyme levels start to decrease. And then what happens is if you don't have a lot of that lactase enzyme and you eat foods that contain lactose, your body is not, your small intestine is not going to digest that lactose the way it's supposed to. And so what should happen is the lactase enzyme should break the lactose into smaller molecules so they can be digested and absorbed. And if you don't have a lot of that enzyme, you're not going to break down that lactose into smaller molecules. And then what happens is the lactose sugar makes it all the way to your colon without being properly digested. And then we have trillions of bacteria that live in our colon, and those bacteria are going to eat the sugar because they like sugar. And that's often what gives you those symptoms of gassiness and bloating and belly pain after lactose. And so primary lactose intolerance is just sort of that natural decrease in lactase as we get older. And so it becomes very common, unfortunately, for us adults to not handle large amounts of lactose well. You can get what's called secondary lactase deficiency, which is when your body doesn't have enough of that enzyme. But the reason is that there's some inflammation to the lining or some damage to the lining of the intestine. And that's what's causing there to be less of that enzyme. So common causes of secondary lactase deficiency or lactose intolerance is celiac disease is a common one. And so celiac disease is an autoimmune disease where kids or adults, their bodies react to gluten, which is a protein in a lot of wheat products that we eat. And it causes inflammation to the lining. And then sort of secondarily, those kids or adults can then also not have a lot of lactase in their system, and they can also become lactose intolerant. And so when we see kids in the office who have symptoms consistent with lactose intolerance, we're often screening them for celiac disease also to make sure that it's not sort of a secondary lactose intolerance. The good thing, I guess, is if it turns out the underlying reason is celiac disease, once you treat the celiac disease, a lot of times then the lactose intolerance gets better. So they can eventually eat some dairy.
Well, twofold, I guess, the question. So much, I think, has evolved like in the medical world about nutrition, right? And what you are eating and how we are a lot of the time making ourselves sick, I think, right?
Absolutely.
So you mentioned something about how we don't need as much dairy. So I don't know if you grew up this way, but when we were growing up, it was like we had milk at every meal.
Yes.
And it was because like, get your calcium, you know, you need strong bones, I don't give my kids milk anymore. There is milk in the house, but we don't like go through it like tenfold. But we still need the same amount of calcium, I'd assume. So what do you recommend for just making sure, especially with, I'm sure you're treating kids a lot that have that dairy intolerance or don't recommend because they have Crohn's or different things that they, it's inflammatory, right? Dairy is inflammatory to our bodies. So what kind of replaces that?
Yeah, that's a really good question. So you're absolutely right. Just to reiterate that we all grew up, our generation, I think, grew up sort of like milk is good for you. And there are great things about milk, but I think you're right. Milk is not great for everybody.
Right.
And there are definitely a lot of people who are learning more and more that dairy just doesn't make them feel good. And, I don't recommend that everyone go dairy free. If you tolerate dairy, I think it's a good source of things like protein and calcium and vitamin D. But I think if whether you choose or you feel like dairy doesn't sit well with you, there are great alternates to dairy. And so for younger kids who still get a lot of their calories and protein from liquids, so those toddler age kids, like the 1 to 3 year olds who are still drinking a lot of milk or calories from their liquids, then alternates like oat milk or pea protein based milk can be really good substitutes for dairy. And those are often fortified with calcium and vitamin D. They also have similar amounts of protein and calories to cow's milk. And so that's often what we recommend. A little different than like almond milk or rice milk, which aren't harmful, but they just don't have a lot of protein or calories in them. So for those toddler age kids, they're not good substitutes. For older kids who are eating, most of their calories and their protein, and they don't really need liquid calories, you're right, they don't really need any kind of milk at all. But then you just want to make sure that they are getting that calcium and vitamin D from other sources. And so there are lots of different fruits and vegetables that are high in calcium. Again, if you have a really picky eater, then you have to be a little bit careful. There are also, calcium and vitamin D supplements that you can take, now made in other chewable forms, like gummy forms and other things. But, that you're absolutely right. That is sort of the biggest thing. You just want to make sure that you are getting, if you or your family aren't huge dairy people, just make sure you're getting that calcium and that vitamin D. But there's lots of alternatives.
Interesting. So Crohn's, celiac disease. Celiac is like the gluten intolerance one, right?
Exactly,
okay. And Crohn's is like a intestinal.
Crohn's is autoimmune, inflammatory.
Got it. Okay. You hear, I think, I don't know if I'm wrong, but you hear more about children having both now than we did when we were growing up. Maybe that's just because of social media. I don't really know. Is that true?
No, it's a good, I think it's a little bit of both. I think that they are actually more common. So they're both considered autoimmune diseases, and autoimmune diseases are becoming more and more common. And, I don't think we yet have a full understanding of why that is. I think, there's probably a lot of different factors. Again, potentially the foods we eat, the things we're exposed to. I do think some of it is also a little bit more of awareness of testing for these things and looking for these things too. But we definitely are diagnosing it more and more, both of them more and more. I think you're also right. We probably hear about it more and more now just with social
Interesting.
media and
Yeah,
friends and
because you
things.
like
But
think, just the way that we receive information is different now
yeah,
than we did. There was books, even when I had my son, it was like I read like what to expect when you're expecting
yeah,
because there was nothing else.
yeah,
There was MySpace, but that we didn't get like information that way.
yeah.
So things have evolved and changed. But do you find in part of your treatment plan then when families adjust how I'd imagine obviously with gluten having to go gluten free, they'll it makes the
Yeah.
they find some reprieve, right?
Mhm.
But in both, like are the as part of the treatment plan when they are adjusting their diet to like eat better
Yeah.
or more, I guess, appropriate to that, do they see like significant differences in
Oh,
how they feel?
absolutely. Yeah,
That's
especially kids. So gluten is kind of a tricky topic. And so um kids with true celiac disease, so celiac disease itself is autoimmune. When kids or adult, you can get celiac disease at any time in your life. And so we know there's a genetic predisposition to celiac disease. There are actually genes that we can screen for.
mhm,
And in order to get celiac disease, you generally need to have one of these genes. That being said, about 30 to 40% of us have those genes and we don't all get celiac disease. But celiac disease is autoimmune. It can sort of come up at any point in life. But it's a true immune system response to gluten, which is this protein that's in wheat products. It's also in barley and rye. Those
mhm.
are a little less commonly eaten. So we focus more on the wheat. But and when kids or adults who have celiac disease eat gluten, their immune system reacts to it like it's some kind of foreign invader, and it mounts this immune response, and it can have effects on all different parts of your body. And so GI is certainly the most common, but kids with celiac disease can also get skin rashes. That's another common one. Skin
Right.
manifestations. They can get like canker sores or blisters in their mouth. They can get joint pains or joint swelling. They can, there's studies that document sort of like what's described as almost like a mental fogginess or like a sort of difficulty concentrating. And older adults, there's been links to fertility issues, and in younger kids, growth issues. That's a big one that we see. Kids that aren't either gaining weight well or they're not getting taller the way that we'd expect them to. And
Mm.
the wonderful thing about celiac disease, and again, I'm not saying I want people to have celiac disease, but I joke with my patients who have it that if I was going to pick a GI disorder to have, celiac disease would be at the top of my list, because unlike a lot of other autoimmune diseases, we know what the trigger is for celiac disease,
Uh,
and that's helpful. And so, there's tons of autoimmune diseases, autoimmune thyroid disease and type 1 diabetes and Crohn's. And unfortunately, we don't have one specific trigger for those. And so
mhm.
the treatment changes based on the person, and some of the treatments can affect the immune system. Where for people with celiac disease, we know the trigger is gluten. Once they remove gluten from their diet, they a lot of times feel so much better. And again, sometimes it's all these different body systems that feel better. I've had parents who have told me that they were getting worked up for ADHD, and then when they realized that celiac disease, then gave up gluten, the attention issues got
So
much better.
interesting.
And so, I a lot of times I tell parents and kids that you got to get through the first 1 to 2 months. And it's really hard because their diet does change, and a lot of really good tasting foods have gluten in them. But most of my patients, once they are gluten free, they feel so much better that they don't miss it at all. The other sort of good thing, I guess, is as we become more aware of it and it's becoming more common, there are a lot of gluten free options for things too. I mean, there's now like entire aisles in stores that are gluten free, and so that helps a little bit too. But and then, along the lines of celiac disease, there are other people who don't have celiac disease. They don't have that autoimmune reaction, but they still don't feel good when they eat gluten, and their celiac
Okay.
testing comes up negative, and we call that a non-celiac gluten sensitivity. And so for those people, it's less important that they're 100% gluten free.
Mhm.
But if I always tell my patients, if you feel better with less gluten, then of course I want you to feel better. And
Totally.
so there are certainly a lot of kids that we see in the office that are on gluten free diets that don't truly have celiac disease, or at least their testing has not been positive for celiac disease, but they feel much better gluten free. And we all have the same goal. We want everybody to feel better. And so you can have a very healthy gluten-free diet. And so we just sort of encourage them that if they can make sure they're eating a well-balanced diet and getting the nutrition they need, if they feel better gluten-free, then, of course they should continue to eat that way.
It's so
Yeah.
interesting. I think the world we live in now is like it's all about wellness, right? And there's so much information out there,
Yeah.
different products, what to get, what not to. I was my mom and I had dinner on Saturday night, and we were talking about how so much information has emerged, but like really, it seems like sometimes even like the simplest things are just are uh, more, I don't know if it's more obvious, I would say, where I was talking to her about how I had COVID over the summer and I never had it before, and it hit me like a truck, and I
You
was
made it a long
really
time.
sick. I
That's
did
good for
4.5
you. Yeah,
years.
that's a lot. That's impressive.
And I was really sick for the whole month of August, and then September I was still reeling from it, having trouble sleeping, and I don't want to say I'm a machine, but I'm on the go constantly, and I run a lot. I'm just and it took me down, and I felt very lethargic, but then having trouble falling asleep. So I went to Target, and I got melatonin, and I also saw these calm gummies with magnesium citrate. That's all it is, right?
Yep, exactly. Yes.
And I was like, okay, these seem okay. I don't like to take stuff, but it's these seem natural, whatever. So I started taking both. I took the melatonin a couple times, and it did help. And then I kept taking the calm gummies just to take them. So, side note, when I was 16, I had a spinal fusion for scoliosis. So I've always had back pain. I've always had just a lot of soreness. If I stand for too long, if I sit for too long, my back hurts, and I'm just kind of been part of my life. And it has been exacerbated over the last year or so. And I, just kind of this back burner thing, but it's annoying. It's more annoying. It's not impacting my life where I don't have a good, but it's whatever. So taking these magnesium supplements a month, fast forward to maybe mid-October, and it dawned on me that my back hadn't been hurting
really
at all.
Yeah.
A little bit, but it went from this to this.
Okay. Wow.
And then put two and two together, and I was oh, there has to be the magnesium. It has to be. It wouldn't just. This has been 20 years.
It seems like too much of a coincidence. Absolutely. Yeah.
Where so it was so interesting that one, kind of then all of a sudden help the other, and I might have had a deficiency, or maybe it just helps with pain. I really don't know. But what I'm getting at is that there is a lot of information about wellness, what to take, what not to. And I think a lot of what you see, especially on social media right now, is about gut health.
Yes.
Okay.
Absolutely.
So what the heck is gut? What does that even mean?
Good question.
Why is it important? For moms, for kids, and especially for kids, right? Because at first you would see more for gut health for women, for perimenopausal women. But now it's about kids having healthy guts. And why do we need healthy guts?
Yeah, absolutely. No, you're right. It's a kind of a hot topic. And I think part of that does lend itself to, you're right, how we get information these days in social media and things. But I think part of it is because we, even as a medical community, are starting to learn how important our gut is to our overall health. And so the vast majority of your body's immune system is in the lining of your GI tract. And so, we're learning more and more that so much of our overall health has to do with the health of our GI system. And a lot of that has to do with what we call the microbiome, which is the combination of organisms that live in our GI tracts. And so it's hard to imagine, but we have literally trillions of organisms living in our GI tract, which is weird to think about. And so it's this combination of bacteria and even some viruses and fungi that live in our GI tract. And we're learning more and more that they have sort of a symbiotic relationship with our bodies, and keeping sort of those organisms happy is also good for our own health. And so I think that's a lot of what we're learning about gut health. And you're right, we're sort of getting bombarded with all this information of you should eat this or you shouldn't eat this, or you should take this or you shouldn't take this. And it can be so overwhelming. And to be honest, again, I think we're still in the early stages of learning about all of this, even as a medical community. And so I really do think over the next couple of decades, we're going to know so much more about specific microbiomes and for different disease conditions, how can we treat the microbiome to potentially help with disease. But I think the most important things, for families to focus on now, because again, it can sort of seem like too much sometimes, and where do I even start?
Yeah.
I think, again, I'm a GI doctor, so I'm biased, but nutrition is really, really important. It's hard. And so I always try to reassure my patients that I joke that my office is a judgment-free zone. I have 3 kids. It is so hard to get them to eat healthy. My middle guy, I swear, lives on Costco blueberry muffins. So I am not judging anybody here, but I do think nutrition is so important for our health and for our kids' health. And so, we know that, a healthier microbiome is in part based on what we eat. And you're right, there's all these sayings, you are what you eat. And there's definitely some truth to those. And so, we're learning more and more about what we call prebiotics, which are sort of the things that we want to put into our bodies that will promote good bacterial growth. And so, a lot of these are going to be foods. So fresh fruit and fresh vegetables. Fermented foods are very good for gut health. And so those are going to be things like yogurt, whether you want to do dairy yogurt or non-dairy yogurt, kefir, sauerkraut, things like that. And again, I have 3 kids. They don't love a lot of those foods, and I know that. But those can be really helpful things to introduce into our diets if our kids are willing. But if those kinds of foods aren't going to be appealing, then again, fresh fruits and fresh vegetables are really, really helpful.
Okay.
Whole grains. So we say whole grains, we want things that are not sort of like pre-broken down and processed. So looking for things that
like rolled oats.
Exactly.
Okay.
Are more nutritionally complete. Those are going to have a lot more fiber in them, which is again very important for our gut health. And so focusing on trying to make those kinds of changes. One of the sort of tricks we say is try to stick to the like outer edges of the grocery store. So the sort of like shop the perimeter. Right. Exactly. And try to limit what you're getting from the middle aisles. If you are going to get things that are more, pastas and rices, which again are great. Again, try to aim for more whole grain versions of those are going to be better.
Okay.
And I tell families all the time to don't, you're not going to be able to make 1,000 changes at one time. It's just not sustainable. It's hard, and so try to pick a couple of things, aim for, 4 to 5 servings of fruits and vegetables a day. And again, that's even, I'm thinking my own kid, he definitely doesn't do that. One of them definitely does not do that, but
that was the middle one.
It's always the middle one. It's the middle one. But, trying to introduce more fruits and vegetables into their diets. And for younger kids, the biggest thing I tell parents is just to keep offering it. And I know it gets frustrating, for those sort of toddler and school age kids. But sometimes toddlers, studies show that you may have to introduce something up to 10 times for them to finally accept it. And so that can be so frustrating to parents, especially because right now produce is really expensive. But as best you can, keep trying to offer them, even if it's very small amounts. Another trick is to serve them with foods that your kid does like. And so we call that food pairing, where, my kids love, my son loves cheese. And so I'm going to give him cheese. I'm going to cut up grapes with the cheese and see if I can get him to sort of eat some of the grapes along with the cheese, but trying to pair things. As kids get older, like more teenage age kids, I think a lot of their eating habits partly come from what's easily accessible to them. And so that's why a lot of sort of snack foods are easier to grab. It's easy to grab a bag of chips. It's easy to grab a bag of pretzels. So one of the things I try to tell parents is to try to have fruits and vegetables more easily accessible, whether that's having them pre-cut in the refrigerator so that it's easy for them to just after school grab them instead of like having to work to cut it themselves. Again, teenagers aren't always going to do that. Having, a bowl of apples on the counter and things like this, having it available. But, when we think of overall wellness, I definitely think nutrition is a huge part of that. As far as supplements, that it gets tough because there's so many things out there. And as a physician, it gets hard to recommend them because a lot of supplements are not FDA regulated. And so we get nervous, especially in young kids, having them take supplements. And again, in pediatrics, a lot of medicines we use are based on a child's weight. And so it's very hard to give sort of general recommendations for kids when, they're all different sizes and all different in developmental stages. That being said, generally probiotics have not been found to be harmful at all. There's honestly sort of mixed evidence of how helpful they are. There is pretty good evidence that they are effective for preventing diarrhea that's associated with antibiotics. So,
right.
And so, that's one of the other sort of tips I have for gut health is we know one of the things that affects the microbiome is giving antibiotics. So as much as we can, trying to limit the antibiotics we expose our kids to is great. Obviously, if you need antibiotics, you need antibiotics. And so strep throat and urinary tract infections and things like that, they have to be treated with antibiotics. And so,
but can't you just give them yogurt too?
So exactly. So right. But
Right.
if your kid does need antibiotics, trying to eat those pre and probiotic foods is my favorite recommendation. If you have a kid who is really picky, then I generally think probiotics are okay too. Mm-hmm. And there's a lot of more kid friendly brands comes in at chewable or powders that you can mix into things. And it's always safest to kind of double check with your pediatrician, but for most kids, they're safe to take. The exceptions would be really young infants. We usually recommend checking with your pediatrician, or kids who have any kind of immunodeficiency should check in with their pediatrician before taking probiotics, because it is technically live bacteria that you're putting in. And but for most otherwise healthy kids, taking a probiotic when you are taking antibiotics is a good idea to sort of help maintain your gut health as best you can. But it's a huge topic, and I think we're sort of just brushing the surface of it in general. And the other tip I have for gut health is also is trying to encourage families and kids to make sure they're getting some exercise or movement in. I mean, there's actually studies that show that the more we move our bodies, sort of the more that helps our GI tract move and process things. So it helps promote more regular bowel movements, and that's all important for gut health too. And so
I read somewhere too recently, I forget where, but it's like if the earlier you move your body and also give your body like sunlight, the better that it is for like all of those things that you're describing, and just like your this is your circadian rhythm.
Yeah, exactly, absolutely, right? Exactly.
And that like it sets the tone for your mental health for the day and stuff like that. So
absolutely. And even young kids, whether it's toddlers, just trying to get them go for walks and outside. Again, I know it's freezing out, but doing our best to try to move. And I think the younger you start that with your kids, the more it becomes part of life. And so I think that is helpful. But the other thing, and again, this is tough, and I am not always the greatest example of that, but trying to model some of these behavior for our kids, I think, is so important, because it's very easy to tell my kids, I need you to eat 4 servings of fruits and vegetables a day. But if I'm not doing that, then it's hard to convince them to do it. And so again, sort of making it part of the whole family culture can be really helpful. Again, hard, but helpful. Yeah.
Is there a link between mental health and gut health?
So there absolutely is. And I think it's kind of like a two-way street. I think our gut health absolutely affects our mental health. And again, we're sort of seeing that more and more. And unfortunately, we're seeing a huge, along with you mentioning that we're seeing more and more GI issues, we're seeing a lot of more and more mental health issues in kids over the past, decade. And I think this is a combination of more awareness of it and hearing about it more. But I think truly we are seeing more mental health issues. And I think there's a lot of factors that have contributed to that. But definitely gut health plays a role. And then we also see a lot of kids who have anxiety and who have depression, who then also have GI symptoms. And I think it's kind of this cycle that we get in where when we're anxious, sometimes that gives us abdominal pain. When we get abdominal pain, that sometimes makes us anxious. And so trying to sort of look at it as a whole person can be really helpful. But yes, we absolutely do see, gut health impacting mental health.
So interesting. Yeah. I'd be, I'm interested to learn like how, the different food companies and everything that's happening in the news about like what is perhaps could be restricted, because you hear so many things about dyes and certain things that are in food. And like, I know like even my brother the other day was saying that their kids bounce off the walls when they have like red dye or something. Yeah. So, it's just important to like really kind of lean into and keep learning, because there's, so I'm sure so much that is impacted that you see every day from children who are, suffering from things that maybe necessarily don't need to be suffering from.
And I'm so glad it's getting more awareness and people are getting, and again, I don't have all the answers, but I am happy that we're looking at those things, because I agree. I hear these stories all the time in the office, and I believe parents, if they, certain artificial things in foods make their kids act differently. And, I think it's something we're going to be learning more and more about over the next, 10, 20 years, but I'm glad that we're talking about it more. And, again, I think that just speaks to, doing our best to try to limit some of the processed foods. And again, I'm not saying none ever, but sort of making more fresh and whole foods the norm, and the processed foods kind of the net.
Right. The night,
the backups,
the Friday night movie night kind of stuff.
Absolutely,
Right.
Absolutely.
So, when, we touched a lot about different ailments that children might have. But if they are having serious, complaints about stomach issues or bowel movements, or, just a whole host of different things, go to your peds, and then they usually refer to a gastro. Is that kind of how it works?
Exactly. I mean, if any kind of what we call acute change. So, I mean, your kid wakes up in the morning and is screaming that their belly hurts and is vomiting. I mean, that's an immediate call to the pediatrician, because then you want to make sure you're not missing something like appendicitis or some sort of.
Do you treat that? Is that who you go to?
So generally, no. I mean, we sometimes see those kids and end up referring them, but a pediatric surgeon who treats appendicitis.
Okay. I think she was on actually one of the pediatric surgeons that was that's at Jersey Shore.
Yeah. But so any kind of acute change, especially again if it's affecting your kid's ability to function and they're laying on the ground, then that's something that we want seen immediately to make sure we're not missing anything very serious. If it's something that's a little bit more gradual onset, then absolutely the pediatrician is the first place we should be stopping. And a lot of times they can start some of the workup depending on what they're seeing. Again, blood work to screen for celiac disease, and sometimes we're doing stool studies to check for infections, and there's markers we can look at in the stool for signs of inflammation like Crohn's. And then of course we're happy we are happy to see our office. Sometimes our wait can be long, and so we're working on that. We know that's so frustrating for families, but we always tell families that if there are some of those very serious red flag symptoms and they talk to their pediatrician, often the pediatrician can call our office, and if it's something that is very urgent, then we make every effort to get them in very quickly. And so that's that can be really helpful. Having the pediatrician kind of be the middleman to help expedite the workup.
Okay. You are in the Hope Tower at Jersey Shore. No, is it called? It's Jersey Shore Medical Center, and then the Hope Tower.
Hope Tower, yep, exactly.
It's Hackensack Meridian Children's Health, right?
Exactly, yep. And then we have a new office up in Old Bridge that we're seeing patients, and then there's also an office in Jackson that sees patients for GI.
That's great.
Yeah.
Oh, perfect.
Yeah.
And it's you and another team member for the gastro department?
Yeah, there are 6 of us now.
Oh, 6.
Yeah.
Oh, wow.
And so we're growing, and again, we're trying our best to get better access, because we know it can be so frustrating when you call and your appointment's months out and your kid's suffering, and it's very hard to sort of wait for that. And so, we just hired another brand new full-time physician who's wonderful. Her name's Dr. Clavins. And so she's now seeing patients. And so, we're busy, which is a good thing, but we're happy to help. We want to get kids in as soon as we can.
Yeah. Well, this has been so helpful, so informative. I learned a lot. Like I said, gut health, in particular is a word that's kind of thrown around, or a term that's thrown around. So you just want to really fully understand what that is and how that impacts children, our kids, and ourselves included. We will link all the details of how you can make an appointment with Dr. Parlow, and how you can find out more information about the gastroenterology department with Hackensack Meridian Children's Health in the program notes here. And you can book an appointment and hopefully get some help for if you're struggling at all. But thank you so much for
thank you for having me. This is lovely. Thank you for all you do. I use your website a lot for my own kids, for activities and birthday parties. So it's been great to meet you. Great to be here.
Thank you. We'll see you soon.